My name is Jack Newman. I'm a pediatrician. I work in Toronto, Canada. And the most important thing about breastfeeding is that it should be the normal way of feeding infants. That when we suggest that both formula feeding and breastfeeding are normal ways of feeding infants, I think we have gotten on the wrong road. Breastfeeding is the normal way. Formula is an artificial feeding, and it really should be used only if it's absolutely necessary. It's a relationship. It's something that's very special. It's a very intimate relationship between a mother and a baby, and I think that this is one of the reasons that so many people are upset by it. They don't like to see such a close, intimate relationship between a mother and child. The most important rule is no rules. That babies should go to the breast when they feel like, when they are hungry, when they're showing that they're hungry, they should go to the breast without any schedules. They should feed in any old position that works well for the mother. They should just not worry about rules. The more we have rules, the more breastfeeding doesn't work. It's unlikely that the mother would have no milk. But there are women who don't produce enough milk. In the vast majority of cases, it's because we make it difficult for them to produce milk. The hospital practices around breastfeeding and even the practices around giving birth often result in mothers not being able to breastfeed with sufficient milk. But even in the cases where mothers really cannot produce enough milk or are not producing enough milk, we can do things so that they can continue breastfeeding and have more milk. Breastfeeding is more than just the milk, and if the mother needs to give supplements, then we can give them in a way that doesn't interfere with breastfeeding. Well, the first thing that happens is that we show the mother how to put a baby to the breast so that he gets more milk. In the case where the mother has nipple soreness, which shouldn't happen, a better way of putting the baby to the breast often results in no pain. And sometimes babies who won't take the breast, we can get them to take the breast just with using a better latch. There is so much that can be improved in the hospitals that it might take all day to discuss it, but we give mothers such bad advice about breastfeeding that it's not surprising that so many women do not breastfeed exclusively. What is actually surprising is that some mothers actually manage to breastfeed exclusively for 3 or 6 months. That's what's surprising, because we separate mothers and babies frequently after birth. We know that if the baby is skin to skin with the mother for the first few hours after birth, then they produce more milk. And the baby often will latch on in such a way that the mother doesn't have pain, and also that the baby gets more milk. So that's just one thing that we can do. We should also encourage mothers to have as intervention-free a birth as is possible. Some mothers would be happy not to have any medication during their labor and birth. Some mothers can't manage that, but we should do the least possible, and we certainly should not do cesarean sections just because. Both are white. They are actually completely different. They are as different as beer and wine. They just are not the same. And any idea that they're almost the same is strictly formula company marketing. And formula company marketing is very, very good. In fact, many pediatricians and family doctors and other health professionals believe that formula is almost the same as breast milk. They are so wrong. I would say the most important thing that health professionals need to do is to learn something about breastfeeding. The vast majority have no knowledge of how breastfeeding works. They have no knowledge of how to prepare mothers for breastfeeding, how to prevent problems, and what to do if problems arise. Mothers need also to know how to know a baby is breastfeeding, how to do breastfeeding in a way that works. Breastfeeding used to be normal and natural, but often the grandmothers never breastfed, and mothers learn from their own mothers, how do I breastfeed? And those grandmothers don't know anymore how to help the mother. So they need to get their information from somewhere else, but not from formula companies. Somebody who knows about breastfeeding can be very valuable to help mothers. And I point out again that most doctors have never had any training in breastfeeding. Maybe they received information about what's in breast milk and what's in formula, sort of theoretical ideas, but real helpful information, no, they don't have that. And so somebody that knows about breastfeeding, like a lactation consultant, should be there to help mothers who are having difficulties. Well, I think it's very important to bring out the fact that not breastfeeding implies certain risks for both the mother and the baby. That it's not the same to breastfeed and to give the baby formula. That, for example, mothers who don't breastfeed are at higher risk of developing breast cancer. And we don't tell mothers that. I don't know why. I think if mothers knew, they would breastfeed. Most women in Romania do breastfeed, or at least they start. But the problem is that the rate falls because of all the poor information that they get, because of all the times they're told they must stop breastfeeding, because it hurts, and none of these reasons should be valuable reasons. They just don't, they can be overcome, they can be prevented, and I think that that's probably the most important bit of information, that most problems can be fixed.